yourself?
Yes.
Okay. I'm Lee Israel. I'm the current president of NAMI Queens Nassau. And of course, I have a deep interest in women's health, women's mental health, and women's reproductive health. What I enjoyed most about reading about you, Bella, was the story you tell about your dad and how he taught you about the brain. He was a neurologist and he taught you the different parts of the brain, how the brain functioned as a very young child. And as a former teacher, which means always a teacher, I really think that the young mind is so capable of learning so much. I think we don't even know how much a young child can learn. And there's evidence on the internet of a 2-year-old reciting all the bones in the body, things like that. It's mind-boggling. What I wanted to ask you before we begin and you start your talk is, what did you teach your daughter the way your dad taught you?
So correct, my father was a neurologist, and even though I didn't become a medical doctor, I think his early instilling in me about learning and about the brain also made me interested in learning about the mind and the body, and learning about how our brain is so important for all aspects, right, of our physical health and our emotional health. And while, again, I don't deal with the medical aspect of the brain, but the mind lives in the brain, right? And so we're, appreciating the mind and the body. And I think I've taught that to my daughter, my other children, about noticing and being aware of their thoughts and their feelings, and the importance of our feelings.
Well, that's great. Thank you. And also, I'm really interested in hearing you talk about emotional resilience.
Okay.
You didn't call it that. What did you call it? Resilience. We talk a lot about resilience now, and I think any kind of resilience we can develop would be helpful for our future, but I think we need to start when children are really young, teaching them how to do that. So I'm really interested in hearing what you have to share with us, and I'm going to turn the floor over to you.
Okay, great. Thank you. And I just wanted to acknowledge that, today the talk was going to be led by my colleague, Patricia Hidalgo. Unfortunately, she couldn't make it today, but she was kind enough to share her slides. And so I'm happy to be here tonight and to be able to share, her information, but with a little bit of my own words, and excited to present this topic to you. My name is Dr. Bella Grossman. I'm a clinical psychologist at Katz Institute for Women's Health, where we focus on the unique health needs of women, and view the whole person, both the physical and their mental health needs. And tonight we're going to be focusing on maternal mental health, understanding the emotional needs of mothers.
Wonderful.
So if it's okay with you, I'll get started.
Absolutely. Go right ahead.
All right. So today, a brief listing of the agenda. We're primarily going to be focusing on mother's emotional needs during conception and pregnancy, postpartum, and motherhood and its impact on mental health with the different PMADs, and baby blues, and then a little brief discussion about mothering during menopause, and then offer opportunities for people, the audience, to ask any questions they might have.
Great.
So with regard to this journey, and I think it is a journey, it starts at the very beginning of conceiving and then, becoming pregnant. And I think this slide really demonstrates that it is a journey and that it's a big transition to become a parent. And it can be helpful to remember that there's constant change right from the beginning, to make time to reflect and observe and ask questions to your providers, to family members, to your community. And to recognize that partners and family members are key in this life transition. Many times, like people will think that, oh, the dad doesn't need to know. They don't have to come to appointments. They don't have to come to parenting classes, right? I'm the one going to be taking care of the child. But really, it's so important to consider it a partnership, right? There's a very common phrase of it takes a village to raise a child, and it really does take a village, and starting to build that village and think about who those people are, who you want to help and support you, even in the very beginning is important.
You mentioned a slide. There's no slide.
You can't see the slides?
Liz, you're muted.
You're on a phone, so you need to swipe right.
Who's on a phone?
Oh,
Liz.
no, I'm on my iPad, but I need to.
Oh, it's the same user face. You know, you need to swipe to see the screen.
I got
But
it. Thank
Liz,
you.
can you see it?
Oh, yes, I'm on a desktop, so I'm fine.
Okay, got it. Thank you.
Sure. And so at Katz Institute for Women's Health, we have various different programs to help women prepare for motherhood, from childbirth classes, taking a tour of the maternity unit, breastfeeding classes, installing a car seat. There's so many different things that people can do to prepare for becoming a mom. And a lot of that tends to focus on taking care of the baby, but actually just as important is also to think about how you as a mom want to start preparing for yourself emotionally as well. The emotional piece is just as important as all of the things that you might be doing to get ready for the baby to come, in terms of like the nursery or breastfeeding and things like that. And similarly at Katz, there's a lot of different information and different articles related to the childbirth experience and what to expect. And because the whole journey of becoming a
Should I put the drops in after you wash it?
because the whole journey can be unpredictable. It is helpful. Knowledge is power, to inform yourself, to read up on this information, to take classes, so that way you can be prepared and try your best to be prepared, and also kind of recognize that things can change, and being open and flexible to what may happen, and recognizing that when things do change or aren't expected, that can impact how we adjust to it emotionally. So giving birth, although it's a natural process, it's also an experience that's filled with multiple possible outcomes. So when women are pregnant, especially with their first, I think women envision like one version of what's going to happen. And oftentimes that's a very idealized version, sometimes what's, portrayed in the media, and like it's a very, again, idealized version. And then when they actually experience childbirth, it can, hopefully it goes all nice and smooth, but oftentimes it doesn't go exactly as you envision it or as you plan. And, I think it's important to acknowledge that unexpected events, whether they're bigger or small, can impact a mother's ability to adapt. And whatever the outcome is, right, we want the mom and the baby to be healthy, and that's the most important thing. And the next slide, I think, goes into this a little bit more, which is that when you look at the statistics of there were over 3 million babies that were born in the United States in 2024. 32.4% of those babies were born via C-section. So I think the importance of this slide is just to kind of recognize that whether it's a vaginal birth or C-section birth, as long as the mother and the baby is healthy, that's what's the most important thing. Sometimes when women have a C-section and it wasn't expected or planned, that can make women have all sorts of different feelings about it, that can be helpful to kind of process with other people or to get support from, and kind of recognize that it's a very common experience, and not to feel badly about one birth versus another. All different births, there's so many different unique things that happen for women in the childbirthing process. And then this is just a slide to show, right, that again, how mothers experience birth. Oh, I think there's actually a way to play it. Let me see if it will play.
We are not a traditional cafe.
Sorry,
We're
one
completely
second.
unconventional. And my website really has to capture the same magic.
I'm gonna push for 5.
You guys hear it?
5, 4, 3, 2, 1. Okay, the next contraction should be about 20 seconds. I can't push anymore. I can't.
You're doing great.
Yeah, keep pushing. Push. Wait. I see something.
What, you do? You do? Oh my God!
Don't say, oh my God, what?
What is that?
It's the baby's buttocks. She's breech.
Oh my God, I thought you had 2 heads.
Is she gonna be okay? She's gonna be fine. She's in a more difficult position, so you're gonna have to push even harder now. Go, push, push. Rachel, you're gonna have to push even harder. Nothing's happening. I'm sorry, I can't.
Yes, you can. Hey, come on, you can. One final push. Ready? 1, 2, 3. Pushing!
Are you okay?
No idea how much this hurt.
Here we go.
She's upside down, but she's coming. She's coming. Oh my God. Oh my God, she's here. Oh, she's perfect. Oh.
She's so tiny.
Okay, so I'll stop it there, but I think one thing to kind of realize in this slide, right, is that they say it's going to be hard to deliver the baby, and then she kind of just does a couple pushes and the baby's out. Again, highlighting this idea that often in the way the media portrays childbirth is that things just go pretty smoothly and easily and everything is blissful and you're so happy. But motherhood is actually much more complex with lots of different feelings, and all of those feelings are valid. And even if you have challenges, that there's a lot of ways to cope with those challenges and to, as you brought up, Lee, to be resilient. Okay, I'll move on to, oh wait, I think I have to bring it all the way to the end before it will. I'm trying to go to the next. Okay, there we go. So pregnancy, delivery, and postpartum impact on mental health. So there's 4 main aspects that need consideration during this time. Medical history, hormonal changes, past mental illness, and trauma history. So it's important to know your own medical history, what chronic conditions you have, what runs in your family, and ask pertinent questions to your providers. It's also important for your partner or support system to know about the relevant information regarding your health and or the health of the baby in case you aren't able to communicate it, right? Whether it's in the midst of a contraction or again, when you're in the middle of labor, emotions can be high. It's hard to think through things, and having your partner be an advocate or another like support person in your life to be your advocate can be so important. Also, it's important to know that there are many hormonal changes that happen during pregnancy, delivery, and the postpartum period, starting way in the beginning with HCG, which is measured in your urine and blood. That's what's helping to promote the pregnancy, all the way to prolactin, which is responsible for breast milk production, and just to be aware, some medical conditions impact hormone production. And after you have the baby, the tremendous drops in estrogen and progesterone, which are needed for the pregnancy, and then all of a sudden plummet after delivery, is one of the reasons why so many women might experience something called baby blues, which we'll get up to, or can impact postpartum depression and anxiety. So being aware that there's all the hormonal changes that happen can be really useful for women to be aware and then cope ahead for. And also in terms of, knowing your own history of depression and anxiety and a family history of depression and anxiety is useful information, because that can increase your own risk for depression and anxiety postpartum. And if you are taking any medications for your mental health conditions, that's important to be aware and to share with your treatment team. Traumatic experiences are another kind of risk factor that can impact risk for postpartum depression and anxiety. Traumatic experiences impact most aspects of our lives. Traumatic memories can be triggered during pregnancy, delivery, and postpartum. Some of the most common traumatic experiences are things like sexual abuse, domestic violence, institutionalized racism. So I think it's important to be able to be upfront with your medical team, with your doctors. You don't have to go into details about it, but I think opening up that communication with your doctors then helps the doctors and you to have a conversation about what's going to help you to feel safe, what are certain boundaries or things that you might need to help you feel safe in those moments, if you need a support person, whatever those things might be, so that your treatment can be tailored to your needs. So you've been seeing on the slides the word PMADs. PMADs include postpartum mood and anxiety disorders. So hold on. So some of those include depression, which is low mood, and other symptoms, which we'll talk about, anxiety, obsessive compulsive disorder, which can be specific to the postpartum period, which relates to intrusive, like an unwanted thoughts, and then repetitive behaviors that are done to try to decrease the distress caused by the thoughts. Usually they revolve around thoughts about trying to protect the baby, like checking on the baby, checking to make sure the baby's sleeping, or washing things, washing hands, washing bottles, things like that. Bipolar disorder, postpartum psychosis, that's another in the category of the PMAD. Postpartum psychosis, it's a rare but a very serious condition, and it happens in about 1 to 2 cases per 1,000 births, and it is a psychological emergency. So if somebody was experiencing postpartum psychosis where they were hearing things or seeing things other people couldn't see or hear, then that would require telling a doctor or going to the emergency room right away, as well as PTSD. So I'm going to go back to the slide before. So PMADs, or perinatal mood and anxiety disorders, they present specifically during pregnancy and the postpartum period up to 1 year after giving birth. Prevalence rate is that at least 1 in 5 birthing parents experience a mood disorder. Anybody can, develop PMADs, but 2 main factors that increase it is biological sensitivities to hormonal changes. So if you've ever had maybe sensitivities to like your menstrual cycles, that can put you at risk. If you've had other episodes of depression and anxiety, or family history of depression and anxiety, lack of something that's not on the slide is that lack of social support and significant life stressors during this time period is another risk factor for experiencing postpartum depression and anxiety. So we reviewed some of the diagnoses that fall under PMAD. And so a little bit more about depression. So depression, I said before, is related to feeling down, but it can also be characterized by feelings of anger, irritability, guilt, a lack of some difficulty with bonding with the baby, changes in eating and sleeping, trouble concentrating, thoughts of hopelessness, and even sometimes thoughts about harming the baby or themselves, or like maybe broader thoughts about not being good enough, or it not being worth it to be there or be present for the baby. And anxiety is some of the symptoms include extreme worries and fears, often over the health and safety of the baby. Some people might experience panic attacks and feel shortness of breath, chest pain, dizziness, feel of losing control, numbness and tingling. So again, these are some of the symptoms. And it's just important to keep in mind that if you have some of the symptoms here and there, doesn't mean you have the full disorder. But if you're having it, daily or frequently, it's intense and it's hard to cope with, then that's more of something to be aware and then seek help for. And the good news is that there are a lot of treatment options for pregnancy or postpartum mood and anxiety disorders. Specifically within the category of psychotherapy, there's something called cognitive behavior therapy, which focuses on our thoughts and our feelings and how that impacts our mood, and figuring out ways to sometimes reframe or shift our thinking. There's also something called interpersonal psychotherapy, which really does kind of focus on this life transition and helping women to process this big transition and, the different modifications that are happening in their life now that they're a mother. Also really beneficial for women can be different psychoeducational groups, whether they're support groups or peer groups or educational groups. That has been found to improve women's experience postpartum. And also there's mother-infant therapy and education that can be helpful as well. So in addition to psychotherapy, there are also safe medications to take. There are antidepressants such as selective serotonin reuptake inhibitors like Zoloft and Prozac, as well as benzodiazepines like Ativan or Klonopin. I think a lot of women oftentimes feel worried about taking medication during pregnancy or postpartum with fears that it will impact the baby, but in fact, I'm not a psychiatrist, so I don't prescribe medication, but in speaking and working with many psychiatrists, there's a lot of research that shows that there are many medications that are safe to take in pregnancy and postpartum and should be considered if you're having moderate to severe depression or anxiety. So in general, in the postpartum period, I think it's important to be aware or be ready that there will be crying. And I like this slide because it shows it's not just the baby, like the newborn that's going to cry, right? If you have other siblings, or if the baby has other siblings, they might cry and you might cry. It's just a big transition all around. And the crying is connected to the hormonal changes. So again, like I said, with the big drop in estrogen and progesterone, that actually can impact the different chemicals and neurotransmitters in the brain, like serotonin being one of them, and that serotonin is connected with our mood. So just being aware that there's a strong connection between hormones and mood. So baby blues, I had mentioned that before. That's a very common experience that a birthing parent might have. There's different prevalence rates cited in the literature, somewhere between 13 to 80%. So I know that's a big range, but I think it's just important to kind of recognize that it is a lot more prevalent than we might have thought before, that it really happens to a lot of women. It's characterized for no apparent reason. You might all of a sudden start to cry, feeling some impatience, irritability, mood swings, poor concentration, insomnia, and restlessness. Baby blues, as compared to postpartum depression, usually happens a couple days after birth, and then for about 2 weeks, and then usually resolves on its own. It's not an official diagnosis. It's just kind of like the label that's given to this experience. Common thoughts that women with baby blues might have are things like, I'm tired, my boobs hurt, who will do the dishes, I'm not sure what to do when the baby cries. But thoughts that require more support or that are more intense, like I'm not a good mom, I should be able to do it all, my baby hates me, I can't control myself, my baby would be better off without me, those are more serious and are indicative of, being more in the postpartum depression realm and requiring, treatment. So I'm going to shift a little bit now to menopause, because menopause is another time or another life transition, or a time which our body and our mind are affected by the shift in hormones. And so one statistic that's given by the National Center for Health Statistics data cited that those giving birth in 2022 averaged older than 29 years old. Older than 29 years old, and those having their first child averaged 27 years old. That's up 5 and 6 years respectively from 1970. So the ages in which women are having children are older. Many women often, are still having children into their 40s. And so if you think about that, the average age of menopause in the United States is about 51, with people experiencing some perimenopause symptoms, within 10 years of that. So if you're having a child at the age in your upper 30s or early 40s, then you might even be experiencing both the effects of the hormonal changes of having had a baby and the hormonal changes related to perimenopause. And so there's a nice slide related to that. So think about how combining all of the perimenopause symptoms with the postpartum symptoms and how that would make you feel. So even a lot more crying. So I'm going to go back also just to define a little bit about perimenopause and menopause. So perimenopause is the phase leading up to menopause when the hormonal changes start and the symptoms might occur. Menopause is defined as 1 year without a menstrual period. However, hormone changes occur over a number of years before the last period. So really this is like a whole new area of research. I think a lot more interest is coming out and people are starting to talk more about menopause. And really like perimenopause is this like larger transition time that it's helpful to kind of think about what are these changes that are happening and how it's impacting us emotionally and physically. And then post-menopause is the time after menopause when you have not had a period for 12 consecutive months. And again, people can continue to experience some of the symptoms, which I'm going to show you in a minute, for several years after menopause. So there really is a large chunk of time in which women might be experiencing these symptoms. So these are some of the most common physical and emotional experiences that women might experience in the transition to menopause. So obviously there's the changes in the menstrual periods. So when people are in the transition in this perimenopause time, there's irregularity. There can also be heavy bleeding and then ultimately cessation. There's changes in hormone levels. So there's a gradual reduction in estrogen, and we have estrogen sites, actually receptors all over our body. It's not just in the ovaries, but actually we even have estrogen receptors in our brain. So that's why when we think about menopause, oftentimes people think about hot flashes and night sweats, but actually there's a lot of different, because we have the receptors all over our body, people actually have other symptoms such as dizziness and brain fog and mood swings. And I think that's important to kind of be aware of also. So there's body changes, as I said before, hot flashes, night sweats, palpitations, sleep problems, emotional changes in mood swings, a shift in how we think about ourselves. Oftentimes women in perimenopause will actually be like more self-conscious than they used to be. So that's something to keep in mind. There's also a focus of attention that turns to aging and health and concerns about their health, and kind of recognizing that they're moving on to this new life stage. Okay. So overall, and kind of summary, in trying to think about maternal mental health and the different changes that women might be experiencing over their reproductive like lifetime, I think it's important to stress how it's helpful to be aware and to be able to identify and name and then express emotions. If you have a history of mood disorders such as depression, anxiety, bipolar, or PMDD, premenstrual dysphoric disorder, that can put you at a little bit of a higher risk for postpartum depression. And there can be ways to be proactive about that by, if you are taking medication, staying on your medication, or talking to your doctors about taking medication ahead of time, ahead of delivery. And for women to kind of recognize, because I think there's a lot of stigma and self-judgment about experiencing, different feelings or negative feelings after birth, and remembering that hormones can play a big impact on how we're feeling. It's important to remember that if there's ways to kind of inform yourself and prepare, not only like with the actual items for the baby, but also learning through classes or talking to others about what happens to the body during pregnancy, both birth and postpartum, that's helpful. Ask the experts, meaning, have a good communication or partnership with your doctors, being in tune with your mind and body, and being able to advocate for yourself, that's really key. And communicate your needs and seek support from the village that you've created. This is the best time to ask and receive any support you can get from loved ones. Consider the resources you have available and what you might be missing during this time. And have discussions with your partner about who will do what. So don't wait till after the baby's born to start having the discussions about waking up in the middle of the night and feeding the baby and changing diapers. Having those conversations early on can help prevent a lot of conflict and help ease the transition. Keep in mind that there's no perfect birth or no perfect postpartum time for the most part. The life transition is messy, overwhelming, and confusing. It's okay to not be okay. And I think the most important thing that I want to drive home in this talk for tonight is that you're not alone, that there's a lot of support that's out there. Well, you're not alone in feeling the feelings that you have. It's very common to feel down or feel anxious and feel, a mix of feelings of also love and joy along with those negative feelings. And you're not alone, that there is help out there from other family members to friends to, professionals. So please speak up, say something, and get help. So with that, I want to open the floor to any questions or comments that people might have.
Yeah. Well, there's a question in the chat.
Okay.
I'm interested in knowing more about body image in a pregnancy.
That's a great question. And I think that also kind of ties into probably like cultural ideals, right? About, what standards of beauty might exist, about what, a good body looks like when they're pregnant, and also ideas about your body bouncing back, and trying maybe to challenge some of those ideals. And I think when women are struggling with the way that their body looks, I try to help people to kind of recognize also to, what are some ways that you can feel good in your body? Maybe that's picking out a new piece of clothing, right? Or putting on like some makeup or getting your hair done. And also feeling maybe gratitude for what your body can do. So not only focusing on like the physical appearance, but, being mindful about the life that's growing inside of you, right? Feeling the baby moving inside of you and trying to feel gratitude in that, and kind of shifting attention away from like the physical appearance and more about the functionality. Does that help to answer the question? I hope so.
I have a question.
Mm-hmm.
Okay, I think a lot about my own 2 pregnancies. I had the baby blues both times, never anything serious after that. But what I am happy about is that I'm reading about the fact that women are being followed longer after postpartum depression. It's getting more attention for long-lasting effects and how long it can continue, which has been surprising. But what I'm curious about is, can it be recognized as I know you'd have to know the mental state of the mother, but can it be pre-diagnosed? Can it be treated prophylactically if somebody, I mean, can it be identified as something that might be coming in a woman's pregnancy and after delivery?
Mm. So that's a good question. And I think when I was highlighting on some of the slides that there are certain factors that we know that might make a woman more at risk, such as having a previous history of depression and anxiety or a family history of depression and anxiety. If you've had trauma in your past, or you have like a lot of like life stressors that all of a sudden are happening, then I definitely think that, especially for talk therapy, right, seeking some support ahead of time can be great. The American, I'm probably messing up the abbreviation, but ACOG, like the Association for Obstetrics and Gynecology, has recommended that all women be screened during pregnancy and postpartum, like 2 weeks, 6 weeks, at different intervals to and assess for depression and anxiety. So not waiting for women to like bring it up, but standardizing across all women that we're trying to be more aware and mindful to ask the questions and ask not only about how the baby's doing, but how they're doing, and then to really listen. So I think there is more awareness that's being taught to the doctors, more awareness that's being given, and like this opportunity of being able to speak with people in the community to recognize that this is a vulnerable time in one's life and it can happen. Doesn't mean it will happen, but to be aware of it, to be aware of what the signs are, and to be aware that there is help that's out there.
Thank you.
Mhm.
Bella, I found it really interesting that that there could actually be an overlap of, premenopausal development with a pregnancy, and a lot of women are having pregnancy in their 40s. So I shouldn't say a lot, but more and more peers, I would say, are.
Yes.
And so that's so interesting to me. That's something that never would have ever occurred to me, that that process starts so early in my mind. 40 seem early to me.
Yeah, no, agreed. And I think there isn't that much research on it, and I think more research needs to be like done on this like interesting intersection, and being aware that with all of this, with all of the reproductive mental health, biology is one aspect, but then we also have the psychological and social aspects as well. And so psychologically, women who are trying to balance, well, we all know that women are balancing and multitasking on so many different things, and not just taking care of their children, but taking care of like parents too. And so if you have even smaller, like little babies, then that can also impact how you're going to be able to handle the different hormonal changes that might be happening as well. So I think it's just something to consider, right? That a person who is having children later on might have a very different experience to the juggle as compared to somebody else who might have had their children earlier and then isn't like worrying about like childcare and balancing, work life in the same way.
I have an interesting question. So when I was pregnant, I had what do you call it, amnio test beforehand, for risk of something I don't even remember because it was 30 years ago. But now everybody is genetically tested. I shouldn't say everybody. I would just say most young women that I talk to are getting some degree of genetic testing done. And I just wonder, does that add to the stress, or does it alleviate stress?
Yeah, that's a good question. And maybe it can vary based on, different women and their different family histories, right? I mean, I believe that knowledge is power, and they're doing a lot of the genetic testing early on. So then it also empowers women to be able to prepare in the best way, whether that is to, be able to set things up for later on or to kind of make decisions about their pregnancies. So, So yeah, I don't know if it is going to be better or worse, but I think all decisions have some element of stress, and making sure that you have like teams and to talk and to process it with people is important.
Yeah, definitely. Yeah, definitely. Okay. Also interesting.
Yeah. Kehlani, were there any other questions also that we want to talk about? Oh, I don't know if she's still on. Okay. So
I'm here. Yeah, I have to find them. Just give me one moment. There was one question I had, like how does a partner or family support play in the mother's mental health, and how can those closest to her provide meaningful emotional support?
Okay, great question, Kehlani. So I think partners and family support is so critical during the postpartum period. And so sometimes it could be like practical help, right, in terms of meals to drop off, or getting up in the middle of the night, because sleep is so important to mental health. But also I think emotional support is just as important. So that can look like just listening without judgment, right? You don't have to fix anything, just kind of listening to what your partner has to say, providing validation. So saying, I understand how you might feel that way, or that is so hard. Encouraging self-care is really important, because again, during the postpartum period, many women are obviously like focused on the baby, but taking care of yourself with like even little things like taking a longer shower, or being able to speak with a friend or your therapist, right? That's important. So having other family members reminding you or giving you space or encouraging you to take that time for yourself is important. And to be patient and remember that this time period, the postpartum time period, there's so many changes that are happening, and it does take time for our hormones to regulate, for our emotions to regulate, and that the feeling won't last forever. So I think those are some ways that partners can help support the birthing parent.
So how do we get this information out? We are talking, we are having a conversation about this. Your field makes you a perfect person to spread the knowledge, but I know I consider Germany very aware medically, and yet I have a cousin in Germany who I don't know well. We just found each other about 10 years ago after separation of the family by the Holocaust. And she was pregnant she was about 42 or 43, had the baby. And I was here in New York, and I knew she had postpartum depression. She wouldn't appear in a picture with the baby. There was no discussion. She wouldn't write about the baby. Her mother had to move in. I knew what was going on, and I sent an article from the New York Times from the diagnosis column. It's about 5 years ago, about postpartum depression to her brother, and he got the message, and they got her help. But their drug plans, their medical plans in Germany are so wonderful, and yet here was a woman, and she works in a drug company. She's an executive in a drug company. And nobody seemed to know that she had postpartum depression.
Yeah, I mean, it's hard. And I think there's also a lot of stigma for people to share how they're feeling. And then people get scared about not wanting to, say anything or hurt anybody's feelings. But I think normalizing it, sharing how prevalent it is, having, offering support and offering the steps about where to get help is really key. And I agree with you, how to get the information out there is an important question. And I bounce it back to you I mean, I'm so grateful that we have this opportunity, right? I know Kaylani actually works with different faith-based communities, so getting information and education out to different churches and other faith-based organizations. The more we can get out into the community and use social media for the good, the better we can, educate women and partners as well.
And should this be part of the continuum of women's health that they start learning about in sex ed in whenever that's taught? I mean, maybe if the whole continuum is taught, it would normalize it a little bit rather than presenting it when a woman is already pregnant.
Yeah, no, that's a great idea.
We have another question in the chat. Jennifer, if you want to ask your question. You just have to unmute yourself, or if you want to type
Can
it.
you hear me, guys?
I hear
Yeah.
you.
One of the things I wanted to ask is that do you guys recommend for women that are expecting to hire support? Because oftentimes many women, doesn't matter their age, the likelihood of them experiencing some form of postpartum depression and anxiety, the likelihood is very high, and it's usually due to lack of support. And sometimes women may not realize that, or a birthing person may not realize that they may need to build their team, assemble their team, and oftentimes in postpartum, that part of their life is usually forgotten because everybody gets excited that they're pregnant, everybody rallies around them. And then usually 2 to 3 weeks after baby is born, they find themselves to be alone mentally, emotionally, and a lot of times physically, depending if their partner has paternity leave to support them. So is a conversation being had to help women to build their team from the time they are pregnant early on to figure out what they're going to do postpartum so they can lower their chances of having depression and anxiety?
Yeah, definitely, Jennifer. I think that's a great point. That trying to have those conversations in pregnancy, right? Thinking about it early on about who's that village, right? Who's the network of people that you can rally for you after the baby's born is so important. And I agree with you. Sleep is like a key point. It's like the foundation to everything else. So if we're not sleeping, then it makes us much more vulnerable to our emotions, into depression and anxiety. I mean, if you're in a privileged position and can hire somebody to come to your home to help with the baby, that's great. Again, if you have a partner with you that can help support you, that's great too. And if not, trying to think about creative ways to, find other people in your life that might be able to come over and let you nap, or come over and, like, even for a few hours, let you sleep. That can make a big difference. So I think that's a great point to stress and make women aware of.
Absolutely, that's a great point. It reminds me of the support group we're trying to start for loneliness and isolation. But the point that Jen made, some people don't have a partner and don't have a support group, and they might need the same kind of communication and a friendship that would help them through after delivering a baby, build their village. That I never thought of it that way, but that could be an entry.
I'm curious, does Katz have support groups before, after, during, that are part of the part of your care? Correct.
Yeah, we actually do have a postpartum support group that Patricia runs. So we have different flyers in OBGYN offices for women who need support. And there are other great programs as well, like specialized to like different areas that I believe that there's like a texting program. I think there's a program called the Moms Program where, they identify women who might have some different social determinants of health related to financial stressors or different medical problems, and they're tracking them toward the end of their pregnancy and sending texts to check in with them. So there are a lot of great programs that are happening at Northwell to stay connected and offered support.
That's wonderful. Really good to know.
Yep. And then also a plug that we have, as you see here in the QR code, for more information on the behavioral health services for women, to please visit Katz Institute for Women's Health website, or to call the number over here. And I'm trying to see if there, oh, and then that's it. So yeah, thank you everybody for listening to my talk and for all the great questions. Not to cut you off, if there are definitely any other questions, I'm happy to.
No, you said you had to be done by 7, so I appreciate your time so much. Is it all right if we send you any questions that come in from the people who are going to be watching this in the future?
Sure, definitely.
Oh, great. Okay, and we hope to have you at future meetings as well. It was lovely to have you and to meet you, and thank you so much for all this information.
Oh, you're very welcome. Yes, I'd be happy to be involved in any way I can.
That's great. That's very kind of you. Thank you so much.
You're welcome. All right,
And
have a
with
good night,
that-
everybody.
Yeah, thank you everyone for coming, and thank you again. So with that, we'll end our meeting.
Thank you, Liz.
Okay, bye-bye.
Good night, everybody.